the instruction I have to give relative to the cure of mental disease may be confined to a very few remarks, as they are to be cured in the same way as all other disease, namely by a remedy which shows by the symptom it causes in the body and mind. Now I am sharing our master's experience from mental disease. He wrote in his lesser writing, "For the first fortnight, I only observed him without treating him medicinally." So as a homeopathic physician, if we do like to treat patients suffering from psychiatric trouble, abnormal psychology, we have to observe the patient very minutely. At the same time, the patient party, they should know the thing. Just hearing few points, just attending few moments with the patients, it is very difficult to prescribe homeopathic medicine those who are suffering from any mental disorder. The present understanding of psychiatry. WHO advocated ICD-10 in relation with classification of mental and behavioral disorder and clinical description and diagnostic guidelines. Now I am corroborating with Hahnemann's idea and latest idea how Hahnemann classified mental disease about 200 years ago. He only classified in 4 groups. What ICD-10 classified more than 100 types. Let us see. Type 1. Almost all the so-called mental and emotional disease are nothing more than corporeal disease. Hahnemann said, almost all the mental or emotional disease are nothing more than corporeal disease, in which the symptom of derangement of the mind and disposition peculiar to each of them is increased while the corporeal symptom decline. In this classification, if we go through ICD-10, we will get by classification F002, F09, organic including symptomatic and mental disorder, from F20 to F29, schizophrenia and delusion disorder, F50 to 59, behavioral syndrome and associated psychological disturbance, physiological disturbance, F70 to 79, mental retardation, F80 to 89, disorder of psychological development, and 90 to 99, behavioral emotional disorder, with onset usually occurring in childhood and adolescence. So, what Hahnemann classified in class 1, now it has been classified in ICD-10 in different types. Then what would be the methodology of treatment for type 1? To this collection of symptoms belong to the first place of accurate description of all the phenomena of the previous so-called corporeal disease. So whenever you are attending any homeopathic physician for seeking help for mental disease, first of all, keep in mind, you should be prepare yourself to say detail the history from since childhood, whatever corporeal disease you have suffered from. Actually, what is happening to our patients, whenever they are seeking our help for mental trouble or psychiatric trouble, hardly they consider is there any relationship with corporeal disease or not. But in type 1, if you do like to have consultation from a homeopathic physician, and if you expect outcome is cure, then you have to detail your past history relating all corporeal disease. And from that phenomenon actually, how the disposition of mind is being altered, we calculate all those things and we analyze all those things, and after all we prescribe for that patient. Then type 2, insanity or mania caused by fright, vexation, abuse of spirituous liquors, etc., have suddenly broken out as an acute disease in the patient's ordinary calm state. Otherwise, he was calm and quiet, getting some stimulation. It may be from mental cause, from vexation, from fright, from anxiety, or from abuse of liquors, etc., suddenly broken out. An acute manifestation almost arises from internal fundamental cause, like a flame bursting forth from it. Yet when it occurs in this acute manner, whenever they are presenting, looks like acute mania, acute manifestation. In that case actually, the ICD-10, if we corroborate, F10 to F19, F30 to 39, F40 to 45 is to be corroborated with type 2 of Hahnemann's classification. Then what would be the methodology of treatment for type 2? It should not be immediately treated with deep acting medicine. Actually, it is for homeopathic doctors. You common people, you are not supposed to know all those things, but just I am sharing idea. Whenever anyone is suffering from type 2, they are not supposed to give any deep acting medicine. There are few medicines, a short acting, but it will act very good to combat the acute situation. Whenever it will be subsided, then the deep acting medicine will be administered. Who have recovered from an acute and mental emotional disease by the use of this medicine, short acting medicine, should never be regarded as cured. So, whenever you are attending any homeopathic physician for any acute mania, he may suggest for you medicine, and after getting medicine you may be recovered. But you should continue the treatment. Otherwise, in later case, if it be relapse once again, it will be more furious. After getting the acute remedy, that is the short acting remedy, the physician will decide on his part when he will advocate or administer the chronic deep acting medicine for that particular patient. As a common people, I am requesting all of you, whenever you are having any trouble, seeming to acute mania or acute mental trouble, and already you have consultation from a homeopathic physician, he correctly prescribed medicine, and after getting medicine, you have recovered, but don't give up the treatment. Continue that treatment to that particular homeopathy doctor. In this point, Hahnemann advised, apart from medicine, if he attend faithfully to the diet and regimen prescribed for him. So, along with medication, diet is also very important for the patient, those who are suffering from type 2. Regarding diet, just I am giving one slide. You all know serotonin is a neurotransmitter that helps regulate sleep, appetite, mediate moods, inhibit pain. Since about 95% of serotonin is produced in gastrointestinal tract, and gastrointestinal tract is lined with 100 million nerve cells, neurons. It makes sense that inner working of digestive system don't just help to digest food, but also guide your emotions, your moods. Don't ignore foods in any way. Mostly we know that we are taking nutritious food, wholesome food to make our physique good. No. As well as it will maintain your mental health. Studies have shown that when people take probiotics, their anxiety levels, perception of stress, mental outlook improve compared with people who did not take probiotics. Now type 3. It relates with ICD F09, F29, F39, F59, F16, 9 and F79. If the mental disease be not quite developed, and if it be still somewhat doubtful whether it is really aroused from corporeal affection or result from fault of education, bad practice, corrupt morals, neglect of the mind, superstition, ignorance, etc. When the cause of the disease, real mole or mental malady depending on bodily disease, in that case, counseling is contraindicated. If we get any history of corporeal disease, just before the attack of the psychiatric problem, in that case, whenever we are treating the patients, it will be considered in type 3, and in that case, if we detect that there is some obvious cause, there may be some obvious cause in corporeal level, after in consequences with this mental symptom or the mental disability or mental aberration develops, in that case, counseling is contraindicated. Then type 4, psychosomatic, the term is known to all of you. There are, however, as has just been stated, certainly a few emotional disease which have not merely been developed into that form out of corporeal disease, but which an inverse manner, the body being but slightly indisposed, originate and are kept by the emotional cause, such as continued anxiety, worry, vexation, grief, wrongs and the frequent occurrence, great fear and fright, Getting all those mental stimulation, now patient is suffering from some corporeal disease. Patient may have persisting anxiety for a long time. Now develops gastric ulcer. Patient may have suffered from persisting and prolonged deep vexation, now suffering from osteoarthritis. In all those things, actually what phenomena took place, it is psychosomatic. Persisting anxiety, persisting vexation gives an opening for development of some corporeal disease. I am eliciting one example from Hahnemann's brief. The sudden death of a son caused the tender mother already in ill health an incurable suppuration of lungs or cancer of the breast. It is observation of Hahnemann himself. Otherwise, the mother was ill due to some other causes. Due to sudden death of her son, in consequences with, she was suffering from lung cancer. In that relation, Hahnemann said, uninterrupted grief, vexation, very soon increases even the smallest traces of slumbering, a fundamental cause of Sora, into more severe symptom. And they then develop this into an outbreak of all imaginable chronic disease. So we should be very cautious. From the homeopathic perspective of consideration of mental disease, I am happy to share you. If you having any persisting mental anxiety, vexation, grief, please give up that. Counsel yourself. I have another life. I am not supposed to live with anxiety all time. I am not supposed to live with anger and vexation all time. I should overcome all those phenomena. Otherwise, if you have any predisposition, you may suffer from grave disease. In this relation, I am sharing you a beautiful example of a research was conducted in Boston University in 2015 or 14. They have conducted a research work between two groups. One group, they are under stress and vexation and grief, and another group, they are under compassion and peace. How they did it developed? The group, those who are in exposure to grief and vexation, they are suggested to remind and recollect all resentment in their life continuously. And another group, they have in a very good place, good emotional atmosphere. Not only that, they have shown some videos with compassion and all those things. People are serving people, people are helping people in different calamities and wars, all those things. Those people are inducted with that compassion. After that, a study is being made. Those people, those who are getting exposure to video of compassion or peace or something good, they are having higher level of salivary IgA. But those who are having exposed to grief, vexation and resentment, they are having lower level of IgE, salivary IgE. Now in COVID-19 recent scenario, I am suggesting you, if you are having always in fear, if you are in always with anxiety, I may suffer from COVID, I may get infection from COVID, like that, due to your raised anxiety level, your salivary IgA level will drop. And if the virus get entry in your mouth, in your respiratory passage, easily it will multiplicate. But if your mental state you maintain in good condition, in good compassion, good peace, that is why I am also suggesting all of you, don't follow COVID news throughout the day and get panicky. Now the situation, common scenario, recent scenario is that everyone may get COVID infection. But what we do now, we can maintain all preventing measures, maintain good health, doing physical exercise, maintain good health, taking nutritious food, maintain good health. It should be in priority level high, maintaining good mental state. If you are not having good mental state, you are under pressure, you are under anxiety, you are under fright, you are under panic, your salivary IgA level will drop down and it will invite more. You will be more susceptible to develop and replicate COVID-19 virus in your body. So be calm and quiet, be peaceful, don't be panicky. Now I am once again connecting whatever actually I am telling regarding psychosomatic disorder. In psychosomatic disorder, scope of counseling is gross. It is only such emotional disease as these which are first engendered and subsequently kept up by the mind itself. That while they are yet recent and before, they have made very great inroads on the corporeal state. May, by means of psychical remedies, such a display of confidence, friendly exhortation, sensible advice, and often by well disguised deception, be rapidly changed into a healthy state of the mind, and also with appropriate diet and regimen. Always take wholesome diet, nutritious diet, which will help to maintain your body, not only body, your mind also, to improve your serotonin level. But the fundamental cause in those cases also is soric miasm, the fundamental, which was only yet quite near its full development. And for security sake, the seemingly cured patient should be subjected to a radical antisoric treatment. That is a part of the homeopathic doctors. Actually, what I would like to say, in type 4, a deep acting anti-miasmatic medicine is to be required to help the patient. Now I am sharing a slide with few homeopathic medicines. Don't take it as a therapeutic value, just give the idea. I am just here putted 4 disposition. In our Mathemedica, we are having a symptom aversion to husband. Generally, whenever any female lives without any cause having strong aversion to her husband, we are not considering him or her to be treated. But we are having medicine. Aversion to family members, we are having medicines. Consolation aggravates. Generally, we are thinking that whenever we are getting in trouble, if someone giving consolation, everyone is feeling good. No, there are few persons, though they feel bad whenever get consolation. We are having medicine. There are contradiction intolerant of. There is a few patients, few person in our society, in our family, in a society, they do not bear any contradiction. They are very much irritable, they are vehement in every moment. We are having medicine. Just I am giving few examples, the scope of homeopathy in different mental disposition. Now I am inserting another slide from different mental causes. If symptom develops in corporeal level or mental level, we have lots of medicine. First, bad news elements from, egotism elements from, grief elements from, even joy elements from. In this connection, I have like to share one of the beautiful case in my life. A boy visited my chamber about 4 to 5 years ago. He was a very good and intelligent, bright boy in his school. His teacher expected him to, he may stand make rank in state level. But whenever he appeared in his examination from the first day, he did very good. After returning from examination, the teachers met him and asked about what happened with you. He said, beautiful sir, I have answered every question in a very good manner and I will get marks, full marks, almost full marks. Then one of the teacher, he said, okay, carry, keep it up, you will get rank in board. Keep it up. Getting this, he became very joyful. Became not inspired, very joyful, and not bear the thing. And being joyful at the evening when he returned in his home, whenever he is ready to prepare for his next day preparation, next day subject, he did not concentrate. What happens to me? Why am I not concentrating? Then he likes to weeping. The parents Asked him, what happens to you? Well, nothing. I do not just concentrate myself in my study. Then what will happen with me? After that, he dropped down in depression, and in that year he did not appear in the board examination. And they consulted a psychiatric physician. Psychiatric physician advocated some psychiatric medicine, getting that he was doing well, but the psychiatric physician advised him not to attend examination in that year. After 1 year, parents with one of his teachers, they consulted me, and having this scope, elements from joy, getting some mental trouble, especially concentration difficulty, flow of thoughts coming in minds and do not concentrate, we are having. Considering all, we prescribe medicine, and getting that medicine he recovered. Not only recovered, he completed his 12th standard, then BSc with mathematics honors, then he ranked in WBCS examination Government of West Bengal. Now he is continuing serving as a WBCS officer cadre in Government of West Bengal. So, in that manner, with homeopathic medicine, if we collect symptom correctly and the patient helps in that manner, we may help the patient at large. So, general instruction for Hahnemann regarding mental disease: the treatment of the violent insomniac and melancholic can take place only in an institution, especially arranged for their treatment, designated institution for psychiatric treatment for the violent cases. Now I am presenting a graph for positive psychology. Actually, whenever we are prescribing homeopathic medicine with corporeal disease, in selected cases it may happen we are prescribing medicine for young boys and girls, those who are suffering from bronchial asthma, and they are very restless, they are inattentive. Whenever we took the case, we asked about from the parents, we got the information. Along with the bronchial asthma trouble, he was restless, he did not concentrate his mind. Whenever treatment is going on, after that, we are suggesting now he is cured, so now we do like to stop the treatment. The parents are requesting, please continue, sir, for another few days, few months. Regarding his mental trouble, in earlier period when he was suffering from bronchial asthma, he did not concentrate properly in his study. But after getting your medicine, at the same time bronchial asthma improved. With that, the psychological state, the concentration also improved. So I am requesting you, sir, please continue for more few months. Likewise, we are helping patients to develop in their positive psychology part. Regarding positive psychology, I am inserting a slide here. In the vertical line, if we consider it is challenge, and in the horizontal line, if it is skill, there should be an harmony between challenge and skill. In few cases, someone may have very good skill. Skill is very good, but the challenge is very less. It is the flow line, it is the success line, but the meeting point does not touch the success line. Why? The harmony between challenge and skill is not matching or harmonious. In another case, challenge is high, but the skill is less. In that case also, it is not touching the flow line. Whenever challenge and skill goes hand to hand with proper harmony, admirable harmonious function takes place, then only we are getting flow. So in our life also, whenever we are moving forward, we are taking challenges, we should develop our skill at the same time. Sometimes we are developing our skill, but we are not having any challenge in our mind. In that case also, what will happen? In that case, we will not touching the success line. We are having sufficient skill, but challenge is less. In another point, challenge is very high, aspiration is very strong, but skill is less. We have to develop simultaneously skill and challenge, and then only we touch the flow line. So now I am like to conclude, homeopathy is a science of human possibilities. Why I am telling? The homeopathic interview is a crucial meeting point and a very important one in the life, not only of the patient, but also of the physician. It is a meeting of two beings, not two persons. It is a meeting of two beings at the right time, at the right place, for the right purpose. To bring out what? Not only physical cure, to bring out the real good, to fulfill the higher purposes of his existence. It could be better if we say homeopathy is a science of human excellency, not only possibilities. As getting homeopathic treatment as a whole, an equilibrium and harmony is being restored in human body and mind, out of which victim becomes healthy both in body and mind, and in consequences with he will enjoy these healthy instruments for the higher purpose of his existence. Those who are only seeking treatment for abnormal psychology may also getting recovered without any adverse effect or inhibition in mental activity. They also exhibit far better potentiality in his life. In this way, through homeopathic treatment, man will fulfill far better and improve potentiality and also attain fulfillment, the goal of human evolution. So, I would like to say, I started homeopathy and mental health, and I like to conclude homeopathy is a science of human excellency. Thank all of you. Blessed is the heart that does not collect resentment. So please, don't collect, don't recollect resentment. Blessed is the heart that does not collect resentment. Thank all of you for your patience hearing.